Kris Sookdeo. I'm here at SBT Medical today with Dominic from Amare. Alright. Dominic, how are you doing today?
I'm fine, thanks. How are you?
I'm good, I'm good. She braved all the traffic to get here this morning.
Thank you for having me.
No problem. Right, so Dominic, tell me a little bit about yourself.
Okay, I am a mom entrepreneur slash microbiologist,
Right.
and I've been on the probiotic scene for about 6 years now.
Alright.
I got into manufacturing fermented foods because a cousin of mine brought back some cultures from away, and I wasn't sure if I wanted to work in the clinical world of microbiology, and it was a great start to a new chapter of my life where I started to promote gut health.
Good. And you've been enjoying it.
I love
Clearly.
it. I had IBS and now it's gone.
Right,
so
right.
I'm enjoying helping others on their journey.
Good. And I am Dr. Kris Sookdeo, family physician, and I operate out of Samoa. Alright, so today we're going to speak a little bit about probiotics. I'm going to ask Dominic, could you just tell me in your own words what are probiotics?
Sure. In my own words, probiotics are essentially good bacteria that help to regulate your digestive and immune system. They can be found in foods or taken as supplements. And yeah.
Good. Just to add a little bit to that, patients usually ask, so doc, I always hear about probiotics. What are prebiotics? Prebiotics are basically the things that the probiotics need to follow, that kind of thing. So Amare has been around for a little bit, and some of the main products are the kefir and the sauerkraut. So we're just going to ask Dominic to tell us a little bit about the kefir and sauerkraut.
Sure. So we also have kombucha as well. The three lines that we do, they vary in probiotic content. So the kefir, I would say, is actually at the top of the probiotic food list in terms of health benefits and the amount of variation of probiotic cultures that you're going to get. So to give you an idea, kefir contains between 40 to 60 different strains of probiotics, whereas a yogurt might contain up to 6. Probiotic tablets as well might be in the billions, but in 1 or 2 different strains. And what we've found is that people that suffer with digestive issues today, it might be your lactobacillus missing, and then in a month's time when you're having the same issues, it could be a bifidobacterium. So for me, when you consume these probiotic foods, you're really giving your body the best opportunity to heal itself.
Okay. So could you tell me a little bit about the products in particular? How much do I have to use?
Okay, so definitely you don't want to consume the whole bottle at once. Reason being that you can actually end up overpopulating your gut with good bacteria, and that can lead you with ending up having the same digestive issues that you started off with. So we recommend that you take 1 shot, which is between 2 to 4 ounces a day after a meal.
Okay.
For the sauerkraut, we recommend 1 to 2 tablespoons a day. Maybe you can put it in a salad or on your boiled egg. It's really up to you how you want to use it, but the key here is consistency.
Good. So let me just have a look at this bottle. So you said about 3 to 4 ounces per
serving.
Per serving. How many servings will I get out of this?
So the whole bottle is 12 ounces. So if you do the 2-ounce serving, you'll get 6 days worth. If you do the 4-ounce serving, you'll get 3 days worth. It really just depends on how badly your gut is feeling at the time of consumption.
Great. Alright, so these are some kefir grains. What I usually do, I put in, let's say, some ginger, some grated ginger, a little bit of brown sugar, and I put it in a jar like this. So this jar is sealed. I usually leave it for a couple of days, builds up pressure, and the fermentation process happens. If you are not busy, you don't have a full work schedule, you have free time, that is definitely a good option. But something that is a lot more, I would say, convenient and easily accessible would be the Amare line. Right, great. Okay,
just gonna throw in that you can buy these in the supermarkets nationwide.
Really easily accessible.
You may may have missed out on some really important probiotic organisms from your mom.
Right.
And also if you were not breastfed, you also would have missed out on some organisms through that. So what happens is that through your childhood and your adulthood, you might end up with digestive issues and a lot of gut-related health problems, including eczema.
Right.
You may suffer with IBS. All these things are caused because you don't have a balanced gut.
Right.
And by taking these products, you basically put back in what you've lost, whether it's through lifestyle, poor diet, taking antibiotics, all of these things. These products are really good for doing that, and it helps with issues like acid reflux, bloating, gas, constipation, as well as a lowered immune system,
Right.
UTIs, which is debatable, and as well as yeast infections.
Right.
Yeah.
So we're gonna dive a little deeper into the medical side of what Dominic have just spoken about. Yes, inflammatory bowel syndrome is basically alternating constipation and diarrhea. It's caused by inflammation in the lining of the bowel, and probiotics have been shown to positively impact this in terms of it decreases the inflammation in the bowel, and it also improves things like chronic constipation, which Dominic, you give me a little insight about that. In terms of chronic constipation, have you seen your clients?
Yes, I've seen a lot of people with chronic constipation get relief, especially when taking the kombucha regularly. We've actually had a lot of customers for a few years who were able to stop taking the Nexium from the acid reflux,
Right.
proton pump inhibitors, as well as they were able to stop taking any other pharmaceutical drugs that they were taking for their constipation. Because of the probiotics, helping them with that.
Good. So definitely get your doctor's advice. Homeopathic medicine is something that we would like to explore a little bit more. But the theories that are postulated here would be digestion versus fermentation, as well as transit time. So digestion is when you take in food, your body actually breaks it down, and it forms those little building blocks that your body can then absorb, and the waste products, such as the insoluble fiber, passes through the digestive system. Fermentation, you take in food, it sits there, and your body actually ferments it, and one of the byproducts of fermentation is gas. Yeah, so you become very gassy, bloated, the distended tummy is very painful. So when you use things like probiotics, what tends to happen is you have increase in your digestion, and then the transit time, the time in which food travels through the alimentary canal, decreases. So food passes through faster because it is digested faster, and you have less settling, less gas forming, and all those symptoms of IBS tend to go away. Alright? So Dominic, before we conclude and go to the taste test, is there anything else you wanted to mention about Amare?
No, I mean, we do have a website with an online store as well, where people can get the products, but I just wanted to promote that, gut health is actually a really serious matter, and it's something that a lot of people bypass and don't realize how important it is. And it's just, it's a lifestyle. You know what I mean? We promote healthy eating, we promote gut health, we promote, immune health, and just love your gut. I think that loving yourself, the best gift that you can ever give to yourself is your health.
Yes. So thank you all for looking at our informative segment. Dominic, thank you for coming by.
Thank you for having me.
Absolutely, and we're going to move on to the taste testing. Also stay tuned for that, guys. Have a good day. Bye-bye.
Bye.
Yeah.
There we go.
So we have, tell me a little bit about these flavors.
Okay, so we have berry, hibiscus, and citrus burst. The citrus burst is kombucha, and the berry and the hibiscus are kefir. So those two are made with fruit teas. We don't use real fruit because it would ferment too quickly. So we use dried fruit. And the citrus burst is also made with dried fruit, but that one has green tea in it.
Okay, great.
So,
and well, the best of all three is This one.
Your homemade ginger kefir.
Yes, it's homemade ginger kefir made with nice clean water, a little brown sugar,
Organic brown sugar.
and some ginger. So we're gonna do the first one. So could you?
So I'm gonna try the ginger kefir.
Sure, I'll try some with you. I guess we'll do cheers.
Cheers.
Great. This is homemade ginger kefir.
Not bad.
Alright, maybe not as fizzy as I'd like, but
How long did you ferment?
this is fermenting for about 8 days.
Okay.
Yeah, right.
Okay.
It's not very sweet.
No, it's not at all.
It's not very
It's
sweet.
tart.
Yeah.
Yeah.
It's complete confusion.
That's good.
The next thing that we're going to taste, so you can choose.
Okay. I want you to try both. So I'm gonna pour out some more of the berry, which is the lighter one.
Right.
We can start with that one, and you can let me know your thoughts.
Yeah. Let's go.
Cheers.
Cheers. This is very.
Very. Reminds me of vitamin C, you know, the purple one. Olive orange.
Yeah. It brought me back to the days of Ribena.
Oh yeah, Ribena, yeah.
Yeah. So it's actually bubbling in there since we've opened it. The first thing I noticed was the effervescence. So that natural effervescence is quite different to what I would see in something like a Coca-Cola.
Exactly.
Yeah, it tends to.
What for you would be the difference between forced carbonation and natural carbonation? I mean, health-wise.
Yeah. So in terms of the effect on the body, so the gut in particular tends to respond unfavorably to carbonated beverages through pressured processes that are unnatural using the carbon dioxide and carbonates. It's a lot lighter through the natural process.
So easier to digest.
Of fermentation. It's easier to digest, and people will notice this when they use the kefir. You're not going to have that much burping and that kind of thing.
Bloating.
Right? So tell me about this one.
Okay, this one is hibiscus kefir.
Right.
And it's actually supposed to taste similar to sorrel.
Okay.
But without the cinnamon and cloves.
Okay.
Yeah.
Cheers. Let me see this. I'm going to sniff this a bit.
Pour some more.
So it's quite light on the palate. It does remind me a little bit about shandy sorrel.
Shandy sorrel.
Shandy sorrel.
That's good. That tastes good.
Yeah. So it's not as sweet as a shandy would be. It's quite light. The fizz isn't as strong, so I don't feel to burp immediately. Tell me about this flavor.
So this is citrus burst. So it has a blend of orange peel, lemon and orange. Yeah. So lemon and orange basically.
Cheers. And this is kefir.
So this is kombucha. Kombucha is really great for giving you a caffeine kick without the crash of coffee.
Okay.
Yeah.
This green tea in there.
Green tea. Yeah.
It tastes it.
The kombuchas are more tart than the kefir.
It definitely has a flavor profile that's a bit more complex than the kefir.
It's also made using a different culture.
Right.
SCOBY. If you look here, you can actually see a baby culture forming at the top. Yeah.
Nice.
If you take that, you can actually make your own kombucha.
Alright guys, I'm gonna keep this bottle for myself. So, Dominic, it's really nice to have you. Thanks for coming by. Right, I hope everybody has learned quite a bit about the positive benefits of kefir, kombucha, the probiotic-rich foods. Amare is a great brand to turn to, and also remember we have things like sauerkraut that's available from Amare. Alright guys, have a
Have a good day.